Hi, I'm Dr. Avyaktha. Today we have our chief guest, Dr. Sanjay from Kokuna Clinic, Dubai. Hi, sir. How are you?
I'm very well, thank you very much.
Sir, I have few questions to you. So, what inspired you to choose aesthetic plastic surgery, sir?
Well, when I was doing surgery, I was told by my mentors that I have very special skill. And one of the skill was I could use both the hands to do surgeries. And I was very meticulous in everything that I did. I was doing suturing in a nice way. So my mentor told me there is something called specialist plastic surgery and you must try that. I had no idea what plastic surgery was. Then I went to see plastic surgery in the department, what they were doing, and I was amazed to see how they were reconstructing and improving the appearance of the patients. So that's how I chose to become a plastic surgeon. But during plastic surgery, what I realized was I had a special interest for body art. I wanted everything to be proportionate, beautiful. So I started focusing on aesthetic surgery. Aesthetic surgery of face, of nose, of body, breast, tummy, and so on.
Thank you, sir. Thank you for your answer. From over the years, I think you have seen an evolution in plastic surgery, especially in aesthetics. So, what have you seen, sir? Is it really easy for young plastic surgeons, or is it really like a red carpet nowadays? Your days were really different. I think so. So, how do you want to comment on it, sir?
See, I think it's definitely much easier now because they have so much opportunity to learn from mentors, from experienced plastic surgeons, and they have everything available on the fingertips. So I think they have a huge opportunity to learn. But secondly, at the same time, of course, it is more competitive now because everybody needs to prove themselves better than the others. So everybody has to work very hard. But I tell you, if they are honest, sincere in their effort, they learn very well and they follow the rules and regulations, and practice safe aesthetic surgery, they can do very well.
Thank you, sir. So, how do you approach high risk cases, sir? Your approach, and what are the precautions do you take over there, sir?
So this is one of the challenge that happens as you grow senior and have years of practice, you start getting more challenging cases. So any patient that comes to me will not be somebody who will not have a problem of hypertension or diabetes or medical illnesses or some bad surgical history. They will have all sorts of complications. So I had to master that. I look at person's individual health in terms of their capacity for everything, like the cardiac capacity, their liver capacity, their kidney capacity, and then I evaluate whether the procedure that I will do will be safe enough for them and give them the result that they are looking for and benefit them or not. If I feel that it will not be safe or it will not benefit them significantly, I will say no. And then I have set protocols for each of the problems to prevent any problem that can possibly happen to these patients.
Yeah, thank you, sir. And till now, I think you have did like more than thousands of surgeries. So, if given a chance, which is your first key role or first way to approach, sir, and which surgery do you prefer?
Yeah, that's a very difficult question to answer. Yeah, I have done 60,000 operations, by the way. So, it will be unfair for me to say that I'd only like doing liposuction and body contouring because I love doing face as well. I love making shape of the nose. I love rhinoplasty. I love making somebody look youthful by blepharoplasty or facelift. I love doing breast surgeries. So I am actually a true plastic surgeon and aesthetic surgeon who loves to do body art. And body art cannot be restricted to one area. It has to be the whole body.
Yeah. Thank you, sir. So, how advanced are the techniques in aesthetic plastic surgery, sir? Now, how advanced are we in? And what kind of message would you like to give to your client? When they approach to us, how can we actually make them very comfortable? With your experience, few words, sir, on it.
So it has evolved a lot. Technologies definitely has advanced, but it's not about technology that has made us do things better. It's the understanding. The technologies has helped us to understand better. So now we understand whatever surgery we do, how to make it safe and how the patients will respond. So I think it has become much more easier than many, many years ago. The surgeries are easy, there is recovery is much quicker, they don't have to suffer a lot of pain that they used to do in the past, all because of different kind of technologies that we have. So I think there is a huge change and it's going to get better and better.
Thank you, sir. Sir, if given a chance, what immediately strikes to your mind if regarding a good review? I'm talking about a patient, so one best compliment which till now you received, sir?
Yeah, again, there's no one best. There's so many. And every time I think about it, I actually feel so thankful to God that I am in this profession, And sometimes I do get tears inside my eyes. I had one patient who was a chronic smoker. She was a lady and she could not breathe through her nose. Okay. And I did a surgery for her to not only improve the shape of the nose, but I improved her airway so she could breathe better. The moment I saw her the next day, she started crying. She said, "Doctor, I had never smelled good things in my life and you made me smell good things. I used to love smoking, now I hate smoking because I don't like the smell of smoke. And I don't know how I was smoking so many years." And she stopped smoking for the next day. I think that was the greatest reward that I heard, apart from so many others.
Thank you, sir. Sir, in another next decade, where would you think of a plastic surgeon? I mean, like aesthetic plastics. This department is going to be, sir, in another decade.
See, in another decade, as far as India is concerned, I think there is a huge growth that is going to happen. There's a huge opportunity there. The reason is now everybody wants to look good. Before, it was only restricted to celebrities or media people or people who had a lot of money. Now it's not true. Anybody and everybody can have access to plastic surgeons and aesthetic procedures and make themselves look good, So I think it's going to grow a lot. And you will see not only from major cities, even from smaller cities, people are so educated now. They have all the access on their phone and they know everything. I get inquiries from some remote places in Madhya Pradesh or some remote places in Uttar Pradesh or in Kerala asking, "Sir, can I remove my tummy?" So that is the thing that people are now expecting for themselves. So in 10 years, it's going to boom. It's going to increase a lot. And it's our job to make it easy and safe for them.
Sir, and lastly, sir, a very good message from you. I mean, all these 2 days, what we have seen, sir. And another thing, regarding a health point of view, how would you like to comment, sir? I mean, how should we maintain a healthy lifestyle?
Yeah, healthy lifestyle is all about balance of, not only physical health, but mind as well. I think mind is the most important. Somebody who can really keep sanity in their mind is the most successful person in the life, because there are so many challenges from eating habits. I mean, you have so many interesting things you want to eat. There's so many things that you want to do which may not be very good for our health, but yet we tend to do. So those are challenges that we have to encompass, So I think living healthy life gives you that energy to drive forward, keep doing new things, builds enthusiasm, and keeping your mind sane will help you make good decisions.
Sir, thank you for your valuable information on whatever I have asked you, sir. Thank you so much, sir.
Thank you very much. You had a lot of things in your mind that you asked, and I really appreciate you asked. Thank you.